People sort of have this misconception that testosterone is only for male because we
Yes.
group them into a type of hormone that's considered a sex hormone, right?
Yes, but it doesn't mean you don't have female hormones as a man and vice versa.
What has been kind of a controversial topic regarding testosterone replacement?
With the Women's Health Initiative, but that the synthetic hormones led to some people think certain types of cancers.
And, as far as we know, there really has never been a study that associated a bioidentical hormone replacement with any increased risk.
Not
of
a
any
single
cancer.
one. That we are tricking your body into thinking it's younger, and there's nothing wrong with that. If we can use hormones to help people through this period of life, and it is a very difficult period of life. And by the way, men go through this too. There's such a thing as andropause. We're just not ourselves.
Yeah.
And maybe some of these effects on our lives, these bad effects, are because our hormones aren't right.
Hello, everyone. This is Dr. Peter Lee from Wave Plastic Surgery. And today I'm joined here with Dr. Ben Lee, who's my colleague and friend. Kind of contrary to a lot of the topics that we've covered so far regarding aesthetics, over the course of next several episodes, we'll be concentrating a little bit more on wellness / how to optimize your health, which I think is a very important topic to cover because, here at Wave Plastic Surgery, we do a lot of treatments, right, to enhance the appearance of people. However, we always feel like we're kind of treating them halfway, right?
We are.
And, a lot of times, when people don't feel comfortable with their appearance, sometimes they're not comfortable with their health as well.
Yeah.
Do you get that feeling when you talk
Well,
to
our
patients?
appearance is a reflection of our overall health.
Right.
And I have to say, a big part of why I went into plastic surgery is I wanted people to help my patients live better lives. And it's kind of like I was doing it halfway. We do these procedures to make them look better, but to me, I've always felt that was like putting a fresh coat of paint on a house that needed more work. And so wellness is right up that alley, I think.
And so that kind of falls into our first topic, is about hormone replacement.
Yes, something near and dear to my heart.
We kind of paraphrase this as BHRT, or Bioidentical Hormone Replacement Therapy.
Yes.
Right? So what is bioidentical hormone replacement?
Well, part of the resistance to hormone therapy in medicine that you might find is there was a study, the Women's Health Initiative in the late 80s, early 90s, that used synthetic hormone, Premarin, from horse urine, I'm told. And that led to some health problems. And so we don't use that anymore for bioidentical hormone replacement. These are from plant sources. They act like our natural hormones, and they aren't synthetic. And so we don't have the problems with these hormone replacement that we would have with synthetics.
And from a chemical composition, it's identical to the natural hormone that we actually produce.
And physiologically identical.
Yeah, I think that's actually so important. In the past, some people have kind of like frowned upon whether you really need to replace hormones, especially if they fall within what we call normal range. You had a testosterone replacement.
Starting in the early 50s, yes.
So tell me that journey, like why you started it. You said that you were told that it's kind of high normal, right?
Yeah.
Range. But maybe you can kind of like talk about what that normal range really means.
Yeah, well, it was high normal for a 50-year-old, but when you think about a 50-year-old, they're starting to, kind of run down a little. And we have, both of us, we have jobs that are, although you think of being a surgeon as an intellectual type of thing, it's also physically demanding. You do case after case after case. And when we were in our training in our 20s, it was normal to go from 6 o'clock to 8 o'clock in the evening. And It was tiring, but we recovered from it. As you continue to do that into your 50s, it gets hard towards the end of the day. And so I was game. I was willing to try it to see if it gave me a little more stamina during the day.
Mm-hmm.
And yeah, I started trying it, and it certainly helped and gave me more of that vitality that I had when I was younger.
So with testosterone, besides the energy, but energy is the first thing that you felt.
Yeah.
That's different.
Mm-hmm. And recovery.
And recovery from like workout.
Yeah.
And things.
One thing about workouts, your workouts are more effective. It was easier to keep on muscle mass, and I'm not talking about bodybuilder type muscle mass, but my workouts were more effective because I didn't have to work as hard to keep that lean muscle on, and keeping the fat off was easier.
Mm-hmm. Yeah. And what about like in terms of some of the other parameters that we measure as we get older? Some of the things that kind of like is not optimal, such as sleep.
Yeah. Well, I don't know any surgeon that sleeps well, but perhaps it helped me with my sleep. It helped me with my daily recovery.
Yeah.
And in terms of everyday life outside of work, I mean, I like to do, I spent most of my life in the Rockies, and we do a lot of outdoors things there. And it really did help me go on those longer hikes. I love to hike with my daughters, and they like to take me on longer walks than I would like to do.
Yeah.
And it allowed me to do that, quite regularly.
Let's talk about then the first hormone, okay, which is the testosterone replacement.
Yes.
Right. And a lot of people have kind of misconception about what testosterone hormone does and whether it's just, for males. You want to kind of like expound upon that?
Well, testosterone is the primary sex hormone that makes men. It gives us our primary male characteristics. However, someone wrote a book, The Secret Female Hormone, and it turns out to be testosterone as well, because it makes us strong and vital and maintains our muscle mass and bone density, which, by the way, is a very difficult problem for women. As they get older, their bone density goes down.
Yes. And for women, and I think that's where sometimes, people sort of have this misconception that testosterone is only for male, because we group them into a type of hormone that's considered a sex hormone, right?
Yes, but it doesn't mean you don't have female hormones as a man and vice versa.
In fact, in women, per unit, the testosterone level is actually, in a normal state, higher than the quote female estrogen hormone. What is important about testosterone?
Well, I think if you think about complaints that our patients would have about their health when they get to middle age, that's us. Energy, and along those lines, a sense of vitality and maybe fatigue. And along those lines too, mood disorders, depression. You just don't feel that great.
Yes. So sometimes, we think about it as just completely just maybe it increases muscle mass, that it gives you a little bit more energy, that you develop a little bit more lean muscle with testosterone. So we sometimes think of it as purely physical.
Yeah.
But it has a lot of central nervous,
Yes, really.
So, one of the first things that testosterone certainly does is that it really does kind of help build lean muscle mass.
Yeah.
Right? For a lot of people, also oxidation of fat.
Yeah.
Right? Especially the visceral fat. And, we know now that lean muscle mass is so critical in terms of not just quality, but the longevity aspect of life.
It pulls... That lean muscle mass pulls on your bones, makes it stronger. And also it keeps your basal metabolic rate up. So I could burn calories more efficiently.
Mm-hmm. And then in terms of like central nervous system, right? Like it optimizes also sleep.
Yes.
For a lot of people, they actually feel cognitively also better, right? In terms of the cognitive function,
Yeah.
right? The kind of things that we kind of like tend to sort of lose as we get older, such as memory,
Yes.
right?
And people
Multitasking.
have that term brain fog, like when they hit menopause or whatever. And I
Yeah.
always wondered about that. And there was a period of time when I um, wasn't as diligent at keeping up with my hormone replacement. And I started to notice that possible, you just don't feel as sharp. And when I restarted it, that went away.
What has been kind of a controversial topic regarding testosterone replacement?
Well, as I said, based on I wouldn't call it a flawed study, but with the Women's Health Initiative, but that the synthetic hormones led to some people think certain types of cancers. But again, it was using a different product than we use.
Right. And, as far as we know, there really has never been a study that associated a bioidentical hormone replacement with any increased risk
Not
of
a single
any cancer.
one. And I know that people hear all these studies and sometimes they contradict each other, but that's what we do in medicine. We have one study that says one thing, another study that says another, and we have to do multiple studies to come to a consensus. But to date, for bioidentical hormones, there has been no link to any kinds of cancer. And I would argue that testosterone therapy helps boost our immune systems to help ward off those the potential risk of cancers.
Right. And there was also kind of a controversy regarding testosterone replacement. And people have associated that with, people who, like wanted to enhance their performance, right? Or bodybuilders types.
Yes.
And there was kind of that controversy
And that's a
regarding
whole different
abuse.
ball of wax. The steroids that bodybuilders take, first of all, they take a high baseline level of testosterone before they even add that. But once you get into the anabolic steroids, you run into all kinds of health effects that are not healthy.
Right. And that's not what we're talking
That's
about with testosterone
not what we're talking
replacement.
about at all. And I want to dispel the belief among women that if we give them these hormones, that they will get bodybuilder type muscle. And men won't do that either. It'll
Yeah.
just help you maintain what you naturally should have.
And I will add that in our experience with our patients, among all the treatments that we actually provide, bioidentical hormone replacement, especially with testosterone, is consistently one of the highest satisfaction procedure that we can give.
In fact, I would argue, and I've had this personal experience, if you go off of them, you want to go back on because life is better.
So we talked about testosterone. The other hormone that's commonly replaced is estrogen in
Yes.
women, right? And there's also been kind of a little bit of a controversy and back and forth between what the studies have demonstrated in terms of the benefit versus the risk. Maybe you can tell us a little bit more about what your experience has been.
Yes, and estrogen replacement there's usually been resistance among gynecologists, although that is changing. And really in the past several weeks even, they've come back and said that there's nothing bad about estrogen replacement for women. We usually do it to ward off hot flashes, the brain fog. And I think it's beneficial for women's health to get on estrogen replacement. I mean, I can usually tell within 6 months of when a woman has gone into menopause. You see the changes in their facial aging and their fine wrinkling of the skin. So that's how profound an effect it has on women's health.
Yes, postmenopausal symptoms, right?
Yeah.
That we kind of group together and say it's hot flashes,
Yes.
right?
And we used to think it was okay for them to have those symptoms, and we just, reluctantly gave them estrogen patches or creams or whatever to ward off these symptoms. But what I think, is that we are tricking your body into thinking it's younger, and there's nothing wrong with that.
Yeah. And I think a lot of women have suffered a lot.
They have suffered, and in fact, the Gynecology Association says we have to apologize to women
Yes.
for our attitude of not treating them.
You're talking about the new studies that came out
Yes.
to really dispel all of the myths regarding the risks of estrogen replacement.
Yeah, and that's pretty profound when a major medical association will come out and say that, basically admitting we were wrong.
Yeah, yeah. So with estrogen replacement, what are some of the benefits that people can expect to actually have?
Well, better sleep, better mood, less bloating, and I think it helps for depression and mood disorders.
Yeah, and I can't stress that enough, right?
Yeah.
About how we feel, right?
Yeah, and I feel very strongly about that because one thing that has popped up that I realized, 70% of the divorces in this country are filed at around age 50. And what is that? That's menopause. And that's a big big social effect on our society because our hormone levels have dropped. I mean, we're using hormones if we can use hormones to help people through this period of life. And it is a very difficult period of life. And by the way, men go through this too. There's such a thing as andropause. We're just not ourselves.
Yeah.
And maybe some of these effects on our lives, these bad effects, are because our hormones aren't right.
A lot of times, when we talk about, mood disorder, quote, disorders,
Yes.
right?
Maybe it's a hormone disorder.
Yes, we sweep them under the kind of the auspices of some sort of a mental, right, disorder, and perhaps the way to treat that is through counseling and things like that. What people sometimes forget is that it's truly physiologic.
Yes, and we don't talk about this. I have to speak on for men at this age, and of course we tell each other to shut up and not talk about how we feel, but there's a lot of men at middle age, they just don't feel like they have a place in society, and their whole world is turned upside down, and a lot of that is andropause.
Yeah, absolutely.
And how much better of a world would we have if we could just, with one little treatment, make people's lives better, make their moods better, and think about how this effect it has on our relationships. Yeah.
Now, there's different ways of administering these hormone replacement, right? From anything from, let's say, oral to topical to pellets,
Yes.
right? Maybe you can just tell us a little bit more about that.
Yeah, and I'm kind of skeptical sometimes about oral intake of protein type drugs because they'll be broken down in your digestive system. So an effective way to administer hormones is through shots. And that has its benefits in that it's bioavailable, it gets into your body. However, with injections, it can spike, and that's not normal. We are better off with a more steady state, which is what pellets are good for. They're little rice-sized pellets that go under the skin, and they release their medication gradually in a more physiologic manner.
Like a slow release.
A slow release, yes.
Right. Okay. And how long does it last? These pellets.
So it depends. With the pellets we put in women, the testosterone pellets, they're smaller, and so women have to do it more often, 4 times a year. It lasts about 3 months. In men, we do it 2 to 3 times a year, but they're bigger.
And so the pellet gives you more of a slow release, steady state, so it doesn't fluctuate like, let's say, topical or just IM shots, right?
Yeah.
And so it delivers things in a more sort of a natural, steady state way.
More like what one of your own organs would do.
Now, is there a difference between how we administer testosterone between men and women?
It mostly in the dose. We tend to use the subcutaneous pellets, and we use far more in men. And because we use bigger pellets, they last longer in men. In women, it's mostly a rice-sized grain of pellet, and done every 3 to 4 months. We just do it more frequently in women. And there's something else about getting the pellet. I mean, that's a physician-administered thing. There are sources where you can get testosterone to inject yourself, but should we really be treating ourselves with something with that, wide-ranging effects? I do know of patients who get it online, and how do they know they're getting the right dose?
Yeah. And every time that we actually, re-administer the pellets, I mean, obviously, we're taking a look at the value, the blood test,
Yeah.
right, to determine, what the next dosage really should be like.
Right.
Right, which I think is important. And along the lines of testosterone, how we actually replace it, we feel like the pellet is the way to go, right, for estrogen as well.
Sometimes I think, oh, this is somewhat inconvenient. Why don't I just do twice a week injections? But I do think it's better to have a steady state.
Yeah, I mean, I absolutely agree. And sometimes, compliance is an issue.
Yes.
Right? We forget to take vitamins all the time.
We do.
Right?
My own medications I forget to take.
and pellet, I mean,
you can't forget that.
You can't forget it, and it's just automatic. With women, besides the testosterone replacement and estrogen, and we're talking about, for women, a lot of times, they actually should be getting a combination of both, correct?
Yes.
Yeah.
And progesterone.
And progesterone. So that is the next hormone that we were going to talk about.
Yes.
So why is progesterone important?
Well, estrogen is responsible for the female menstrual cycle and building up the endometrial lining in the uterus. If that is allowed to keep on going unchecked, then that's not a good thing. And progesterone is what we call a differentiation hormone. It allows that process to mature, so you flush out that lining every month. And so it kind of counteracts estrogen. And that's the way we're designed.
Yes. And it also has some cognitive benefits as well.
Oh, yes, that's true.
Right, for a lot of women.
And it helps them sleep better.
Yes. So they all kind of like work as an adjunct
right.
with one another.
So you should not be ordering this stuff online and giving it to yourself, because it's a very complex issue, and it doesn't work the same in everyone.
Yes.
Just like a diabetic, the same treatment doesn't work on everyone.
So just to be clear, progesterone is more for women who still has the uterus. People who's, let's say, had a hysterectomy and has removed their uterus don't really need the progesterone replaced.
Yes.
Okay. The other hormone that's sometimes overlooked, but really should be just as important as the hormones that we just talked about, is the thyroid hormones.
Yes, and that was impressed on me in medical school. Thyroid hormone deficiency is very prevalent in the population, and you can see these effects as early as the 20s.
Yeah. And so what is the function of the thyroid gland and the thyroid hormone?
Well, the thyroid hormone regulates cellular metabolism. So it helps with your energy and how well you can burn off your calories. And it also has cognitive issues as well. There's so many components that seem to do the same thing, and they overlap. But that's why it's very essential to have this done under the supervision of a physician.
Right. And as you said, I mean, thyroid hormones are the regulators, right?
Yes.
Of our basal metabolic kind of like function.
Yes.
And if the thyroid hormone is off, then nothing else works.
And I would say that I've seen people who all of a sudden lost weight, and it wasn't the GLP-1 thing. It was they were thyroid deficient and they didn't know. And so I think it is the most potent regulator of our metabolism.
Right. And sometimes we tend
That has to be right.
Yeah, and sometimes we tend to kind of overlook the thyroid hormones.
Yes, and regarding that, sometimes your labs will say perfectly normal. But this is one of those hormones that's different. Sometimes it does need to be a little higher than normal.
Yes, right. And sometimes it's not one specific value that you look at. You actually have to take a look at the entire thyroid panel to be able to determine.
Because, yeah, most of the values could be normal, but there's one that tells you need more.
And so today, we talked about the 4 hormones, the testosterone, estrogen, progesterone, and thyroid hormones, which really sits at the foundation of optimizing our health. And because the quote normal range of all of these hormones are so large, right? From one spectrum to another. And some people feel better at certain levels. Some people feel worse or better at different numbers.
That's what always impresses me. No two people are the same.
Yes. You have to really individualize and really apply the precision medicine, based upon the individual. If people have found this episode informative and educational, please like and comment, and hope to see you soon in the next episode.